Okay, let's unpack this. Today, we're diving deep into an injury that, well, it can silently derail careers and daily life. We're talking about labrum tears, especially for folks in those demanding federal jobs.
Mm-hmm.
We've pulled together insights from medical journals, top orthopedic specialists, and also federal workers' comp experts, really trying to give you the clearest, most actionable picture possible.
Yeah, and cut through the noise, right?
Exactly. Our mission for you is to arm you with that critical knowledge, what these injuries are, how they uniquely hit federal employees, and crucially, how to navigate the system.
The system for proper care and hopefully a full recovery.
Right. And here's where it gets really interesting, because it's not just pain we're talking about, it's careers, quality of life, getting back to what you love.
What's fascinating, I think, is how often these injuries, particularly, within federal service, are misunderstood, or maybe their long-term implications are just completely overlooked.
Yeah.
So we'll start by shining a light on the injury itself, a labrum tear. It's basically damage to that ring of cartilage. The cartilage that lines and stabilizes our ball and socket joints, most often the shoulder or the hip.
Like a gasket, almost.
Exactly, like a rubber gasket. It deepens the socket, keeps the joint stable, secure. Now, tears can range from just mild fraying, you see that often with wear and tear over time, to more severe forms. The cartilage might completely detach from the bone, sometimes even pulling the biceps tendon with it.
Wow.
There are medical classifications, sure, but the key thing for you to know is that the severity varies a lot, and that directly impacts treatment, recovery, everything.
And you mentioned SLAP tears.
Yeah, that's a common one, especially in the shoulder. A SLAP tear often involves that biceps tendon anchor we just talked about.
Okay, so that's the medical side, but how does this actually play out for federal employees? People in really tough jobs.
Yeah, exactly.
We're talking TSA officers, USPS postal workers, VA healthcare staff. These are dedicated people.
Absolutely. And their jobs are incredibly physical. Lots of repetitive lifting, reaching overhead, maybe sudden forceful movements.
I can picture it. A postal carrier with those heavy mail bags, day in, day out.
Or a TSA agent lifting suitcase after suitcase onto a conveyor.
Right. That's going to put strain on the shoulder.
Extreme strain. And it can be cumulative, or sometimes it's just one single event, like trying to catch yourself during a fall. And that constant tugging, maybe from the biceps tendon against the labrum, that can eventually lead to a painful pinch or, even an audible pop sometimes.
Ouch. So that raises the big question, right? What happens if this injury happens on the job?
Right. And this is where navigating the system gets critical. The surprising thing isn't just seeing the right doctor, it's mastering a few seemingly simple forms.
Okay.
Federal workers, they have a pathway through the Office of Workers' Compensation Programs, OWCP, it's part of the Department of Labor. But properly filing a CA1 form, that's for traumatic injuries, or a CA2 for occupational injuries, it is absolutely critical.
Critical how? Like, what happens if you mess it up?
Well, overlooking just one detail on that CA1, for example, it could cost you months of benefits. It's that serious.
Wow, okay.
You have to establish that the injury is work-related. That requires a physician's report, what they call a report of causation. That's paramount for getting your claim accepted and getting treatment covered.
So the paperwork really matters.
Immensely. Federal injury specialists always emphasize this. Accurate documentation, strict compliance with OWCP procedures, that's how you avoid delays or even getting your benefits jeopardized.
Okay, that sounds serious. But let's talk about the what if. What if someone doesn't get the right treatment or maybe delays it? What are the long-term stakes?
Yeah, and this is where it gets really crucial for your future health and career. Without proper treatment, even for partial tears, the symptoms often just get worse.
Worse how?
Chronic pain, progressively limited movement in your arm. A small tear can actually get bigger or even detach completely. That increases instability, that really unsettling feeling like your shoulder might just give out.
Oh yeah, I can imagine that's worrying.
And think about this. Over time, these abnormal joint mechanics, they can speed up wear on the cartilage. We're talking faster deterioration, even leading to early onset arthritis.
Arthritis from a labrum tear.
It can happen, absolutely. An unstable shoulder is also just prone to getting injured again. Simple everyday activities could cause a subluxation.
That's like a partial dislocation.
Exactly, a partial temporary dislocation or even a full dislocation. Experts warn that SLAP tears, in particular if left untreated, often result in chronic pain and potentially more serious problems later.
Problems needing more invasive treatment down the line, you mean?
Precisely. More complex surgeries, longer recoveries.
Okay, so connecting this back to the job.
Yeah.
How does a labrum tear really impact a federal employee's ability to actually do their work?
Profoundly. Many of these federal roles are so physical, these injuries can be genuinely debilitating.
Right.
Imagine that postal worker again. It may be unable to carry mail bags or even operate a steering wheel comfortably because of pain and weakness.
Or the TSA agent struggling with the scanner.
Exactly. And recovery, especially if surgery is needed, it's not quick. It can take a significant 6 to 12 months for full rehabilitation.
6 to 12 months, that's a long time.
It is. It means extended time on restricted duty
Yeah.
or maybe completely off work. That puts immense strain on, career progression, finances.
Yeah, absolutely.
And sadly, some workers might face ongoing limitations. Limitations that prevent them from ever fully returning to their old job.
Which could mean?
Potentially, yes. It could even force an early retirement from federal service.
Wow. And it's not just work, is it? I mean, this spills over into everything else.
Oh, absolutely. Life outside work is hugely affected. Think about just simple daily things we take for granted.
Like what?
Reaching for something on a high shelf, maybe putting on a shirt,
Yeah.
even combing your hair. All of that can trigger sharp pain.
Things you don't even think about usually.
Right? Lifting groceries, doing yard work, playing with your kids. Suddenly, these are painful challenges. Hobbies, too. Tennis, swimming, even running, actually, especially if it's a hip labral tear, might be off limits for a while or permanently.
And the chronic pain must affect sleep, too.
Definitely. Chronic pain disrupts sleep, leads to frustration, impacts your overall well-being. It's a whole cascade effect.
Which really highlights why getting proper management, including that physical therapy, is so important.
Exactly. It's crucial for restoring function, getting you back to your normal activities, both on and off the job.
So given how serious this is, what's the first step? Seeing a specialist seems key.
Promptly, yes. Seeing an orthopedic specialist is often the best course. And here's something important. Under OWCP rules, you have the right to choose your treating physician. That's powerful.
Okay, good to know. So who should you look for?
For a labrum tear, ideally a board-certified orthopedic surgeon, and even better if they're familiar with Department of Labor cases.
Why is that DOL familiarity so important?
Because they can accurately diagnose, often using an MRI, and figure out the best path conservative treatment, like rest and therapy, or if surgery is needed. Usually, it's minimally invasive arthroscopic surgery to repair the tear. But crucially, an orthosurgeon experienced with federal workers' comp cases. They know how to complete all the medical reports properly, like the CA-20, the attending physician's report. They know how to fill it out thoroughly to meet those specific OWCP requirements.
Yeah, so they know the system.
Exactly. Choosing a doctor who understands how to navigate OWCP can make a huge difference. It can help avoid claim denial, ensure you get the care you actually need.
Right.
And that specialist will also coordinate closely with physical therapy. That's vital for optimizing recovery, strengthening muscles, restoring range of motion, and really importantly, determining when it's truly safe for you to go back to work.
Okay, so finding that specialized support sounds like, well, like a game changer, honestly.
I really can be.
For federal workers, clinics that not only treat the tear well, but also really get the whole OWCP claim process, they must be invaluable.
Absolutely.
You want to look for centers with board-certified orthopedic surgeons on staff, people who specialize in these kinds of joint surgeries, and critically have that extensive training in DILO WCP injury cases.
Right. That combination is key.
Because then you're getting top-notch surgical care, plus that deep knowledge of federal job demands and all that complex DOL paperwork.
And ideally, the center takes a multidisciplinary approach.
Meaning
They offer the orthopedic care, but also experience physical therapy and rehab all under one roof.
Integrated care.
Exactly. That integrated approach, it can significantly speed up your recovery. And it helps ensure you meet the specific physical requirements you need to return to duty.
Makes sense.
And what truly sets these specialized providers apart, I think, is that deep knowledge of the federal workers' comp procedures. Their staff should be really proficient in correctly filing all the OWCP forms, and this is so important, establishing the work-related cause of your injury.
That causation piece again.
It's the absolute key. It's how you get claims accepted and maximize your benefits. So look for providers that really prioritize compliance, accurate paperwork. Some can even offer assistance with those DO forms, the CA1, CA2, CA17, CA7.
That kind of help must be a relief.
Huge relief. They're OWCP claim specialists. They should really excel at approvals, giving you confidence and a clear path forward, whether you're USPS, TSA, VA, or another federal agency.
Okay, so let's try and synthesize this. What does all this mean for you, the listener? We've seen labrum tears are definitely serious. They can endanger a federal employee's career, their quality of life, if they aren't handled properly. The key takeaways from our deep dive today seem pretty clear. First, understand the injury itself.
Right. Second, recognize the vital importance of getting prompt, specialized treatment.
And third, grasp that critical role of managing the OWCP claim properly, all essential for recovery and protecting your future.
Absolutely. Yeah. Ultimately, knowledge is great, but it's most valuable when you understand it and can apply it. By partnering with experienced providers, people who understand both the medical side and the bureaucratic challenges of these federal workplace injuries, that's how employees get empowered to get the care they need and protect their health, protect their career for the long term.
Well said. Okay, here's a final thought for you to ponder as we wrap up. Think about this. What small, maybe seemingly insignificant ache or pain in your daily life might actually be a quiet signal? A signal your body is sending about maybe a much bigger problem brewing just beneath the surface? And how might taking that signal seriously right now protect your long-term health, your career, and just your ability to do the things you truly love? Don't ignore those subtle warnings. What might start as just a small tear, well, it can quickly become a very big problem if it's left